Hi, Grace. I'm Lauren. I'm going to be your occupational therapist today. How are you?
I'm good. How are you?
Good. Okay, so I saw that you have your left total hip arthroplasty, right? That's on the posterior side. Okay, so today I'm here to help you. We're going to sit up at the edge of the bed here, get you up out of bed, and move you over to this chair over here. And then once you're in that chair, I'm just going to show you how you can put on your socks while also adhering to all your precautions that the doctor put in place because of your hip replacement. Sound good?
Mm-hmm.
So throughout this whole process, I want you to help me out as much as you can, do as much as possible, okay? And let me know if you feel any pain at all throughout the whole process. Okay. So first, what we're going to do is I want you to help me move this as much as you can. Okay, so can you move this towards me at all? Okay, I'm going to move it for you. And then can you move this one towards me? Okay, perfect. So I also want you to make sure that you're helping me by moving your upper body that way. And so as we move this way, you're going to move that way. So I'm going to move this one and have you move that over here. Keep going. Perfect. Bring this over here. Feeling okay?
Mm-hmm.
All right. So then bring this over here. Perfect. So now we're going to sit you up. Can you sit up by yourself?
Mm-mm.
Okay, so I'm going to have you grab onto my arm here, and we're just going to lift you up, okay? So put both hands on my arm, grab on, and 1, 2, 3, up. Great job. Okay. So now I'm going to put this gait belt on you here, and this is just used for safety precautions, so to make sure that you don't fall or slip, and I can keep my hands on you at all times. All right. Put this over your head here. Perfect. Make sure it's nice and tight on you. Feeling okay?
Yep.
All right, perfect. So now that that's on there and I have your non-skid socks on, so we're not going to fall or slip or anything. So we're just going to move you to the edge of the bed just a little bit more, okay? Help me as much as you can. Okay? Keep going. Perfect. Okay. So now what we're going to do is we're going to move you from the bed over to the chair, okay?
Okay.
All right. And just help me as much as you can, okay?
Okay.
All right, so I'm just going to put my foot right between here and 1, 2, 3. Perfect. And lean back. Put your hands back there. Sit down. Great job. Okay. So now we're just going to scoot you back just a little bit, okay? Perfect. And so now that you're sitting in bed here, I'm just going to take the gait belt off. Are you comfortable?
Yes.
Okay, perfect. And stay like this. Perfect. Okay. So with your precautions, has the doctor gone over them with you? Do you understand them?
Mm-mm.
Okay, so you cannot bend forward more than 90 degrees. So like when you're sitting in that chair, it means that I want you to keep like an L position, okay? So we can't lean forward to try and touch our toes. We can't lean forward to kind of put our shoes on or put socks on, and we also can't bring our knee up to help assist us with that, okay? Does that make sense?
Mm-hmm.
Okay, and I also just want you to make sure that you're keeping your feet straight forward, so we don't want to be bending them in or out, and we don't want to be crossing our feet or putting our knee over our legs, okay?
Okay.
Does that all make sense?
Yeah.
Okay, perfect. So since you can't bring your knee up to your chest to put your socks on, I kind of wanted to go over and explain something to you. So we have something called a sock aid, and the sock aid's used so that you can keep that straight angle, that 90-degree angle, the L that you're supposed to keep, while also putting on your socks. So what we would do first is we would put the sock aid in between our legs here so that we have a good grip on it. And then I would want you to take your sock and we would kind of bunch it up like we were going to put it on. But instead of putting it on our foot, we're going to put it on the edge of the sock aid. And then we're kind of going to pull it up towards the back of it, which will have those two little prong sides. So you know that's the edge. And then once it's all the way up onto the sock aid, you would kind of drop it down between your legs, but they have ropes that you can hold on to. So we would drop it down while holding on to the ropes. And then when we get it down there, we're just gonna slip our foot in it, okay? And then we're just gonna pull up with the ropes and your sock's gonna go up over your foot, okay? Does that make sense?
Mm-hmm.
Okay, perfect. So when we have it next time, we can go ahead and practice with that, but that's a great use since you cannot bring your foot up to your chest. So do you understand how to use that and understand that you can't bend forward or anything like that?
Mm-hmm.
Okay, perfect. Well, thank you for meeting me. Are you comfortable like this? Are you in any pain?
I'm okay.
Okay, perfect. It's nice talking with you, Grace.
You too, Lauren.
All right, bye.